This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey. Today's program has been pre-recorded.
Talk Radio 1210 WPH.D, WPH.D, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to another edition of Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We continue our different type of show here with Dr. Molly and yours truly, John Damazzi. We are coming to you from Innovative Medical Associates, and the reason is we are on tape. And well, we thought we would bring in some patients and tell the story of how they came here and what it means to them and how it's really helped them as far as their condition is concerned. So, Dr. Molly, you just want to give us a brief intro into what we're doing today and how we're doing it. What are we all about, Dr. Molly?
Hey, John, you ask this question every week, but I think it's a good question to ask. We are a group of like-minded healthcare providers who really all work out of this facility, the facility we're in today in Marlton, New Jersey. And the thing that separates us from most primary care physicians is that we believe in using the least amount of medication possible to help a patient effectuate their medical challenge, to effectuate the change in their medical challenge, and also reduce the need for side effects. And I guess the best way that I can say that we do this is through hydration. However, when we look at natural substances, there's a million of them out there. The question is, you need some good advice as to what natural substances can be put together to help a patient not cause a problem, reduce the side effects. It's very similar to going into the health food store, only here you're getting actual really good constituents from these products that actually help effectuate the change.
You talk a lot about the synergy between one nutraceutical and another.
Right.
And you, of course, being a scientist, are an expert at this.
Well, I'm pretty good.
Knowing what to, you're
listen,
better than a novice, okay? But the key is here that you know what to mix with what and how it's going to affect. Right. And that's the key to this whole thing.
I would say that is true. And also the delivery system, which is through hydration, as you know. I think it's really important to talk about my patients. And in this case, okay, Barbara's been with me for a while now, right?
3 months.
3 months. And the thing is, she's on the weight reduction course, which I didn't really want to say without your permission, which he sort of program. You sort of caught me there, John. Okay. But she's doing so well. And really, I don't necessarily think you came to me with that in mind. This was just something that came up. And as a result, I got to tell people out there, it's not something I always push, really, the weight reduction program.
You don't.
But I think you're a good example of why people shouldn't just fall for these places that tell you to call and take it on the internet and we'll send you the stuff and whatever. Because I found that most people quit it too quickly, and they don't, because they don't get the encouragement they need to get through some of the side effects of the weight loss drug. So with that being said, talk a little bit about what brought you to me in the first place and why I think you're doing so well.
Thanks, Dr. Molly. I came here really 3 months ago. My pastor had been coming for quite a while. And I came here initially, I had been through 2 lumbar fusions, so I had back pain even after the lumbar fusions. And it was significant, and I was still trying to deal with back pain. My pastor has seen Dr. Molly for years, recommended her, and I did come initially for back pain. And try to relieve that inflammation that's been causing all of those symptoms. So we started with that. My back pain started to get better. But in the same course, I was told to lose weight. It's very hard when people tell you to lose weight when you're having back pain. And so I've been having that for quite a while. I mentioned it to Dr. Molly that every doctor kept saying I needed to lose weight, but I wasn't able to do that on my own. Or I lost some, but wasn't able to complete the process. So I started to come here for weight loss. I am on my I believe I'm trying to think. On my 7th or 8th session of weight loss. And I'm being monitored every week when I come in here and I receive my weight loss medication. I'm monitored by Dr. Molly and the staff, taking blood pressures, checking your weight, looking at how you're doing for any side effects. And knock on wood, I have not had any severe side effects. But all in all, I am now, and I can say that I'm probably now down to about 7 or 8 pounds. It comes off slowly. Today was a good day, and I've lost another 2. And I have to say, I'm wondering if that also helped my back pain.
Yeah, they say that weight loss, you have to lose slowly. These diets, there's a million diets.
There's a million.
Lose 20 pounds in 20 days. Oh, come
Right.
on. You can't. And they're all over the place. I mean, there's every.
And there's so many.
Yes, and every day. It's like, is there anything else but diet commercials? I mean,
you're right.
Yeah.
You're right. And you don't know who to go to.
Yeah, that's right.
And I think you need monitoring. It's
yes,
very important
that
to
is
monitor that.
That is exactly
and to
right.
give you encouragement to keep going if you're not losing as much as you
That's right. That's right. So you have you had a weight loss problem for a long time?
I have had a weight problem my entire life. And then having back surgery, and then I tore my quad in my knee 6 months after my last back surgery. So that was 7 months of recovery. And I gained weight, and I gained a significant amount of weight. So that's not good on your joints when you're trying to, after back surgery.
That's right.
Or for your knee after knee surgery.
Yes.
So it was a double-edged sword. I needed to lose weight, but I couldn't be as active as I wanted.
And so now you're feeling like you're on the road to feeling better and looking better and all of that stuff. So what is the prognosis for the future? Like, you're going to keep coming here, or what?
I am. I think that not only for the nutritional piece of it, which I'm still receiving nutritional hydration, but I think also this is a long time. It's not going to come off right away. And then follow up, I think you need some encouragement for follow up.
Yes.
Or else you get into those bad habits and then you're back again to where you started, which happens with a lot of the weight loss programs.
Yes.
Any of those programs that you're eating their meals, and if you
and then as soon as you go off, you gain it back again.
10 pounds again.
Yep.
So I truly believe that coming to Dr. Molly is going to be a huge benefit to me, and I'll continue.
And this is a separate Dr. Molly does not talk about this a lot, the weight loss program, but she has it. And for those who, like yourself, who may want to try this, it's certainly a lot of advice and a lot of counseling and a lot of hand-holding.
It is. And we talked about it before we did it. The benefits, what you may experience or may not experience as side effects. So we did talk about it. And I think that you need that. I think sometimes you need that encouragement because it's hard doing it on your own.
Yes,
especially when
really
you've had a significant weight loss, weight problem.
Yes, and you've had it for...
all my life, 67 years.
Wow. You look good, by the way.
Thank you.
This is radio,
years.
not television.
Right.
But they can't see you. But, I mean, I'm looking at you. I thought you were about 50.
Thank you. But long time. And it's funny, my brother passed away recently, and I was looking at pictures as we were going to do all of this, and you could see where I was really at a high level, then I lost, then I gained it again, and I lost. The pictures told the story.
Yeah.
So I'm hoping that with Dr. Molly's encouragement and advice, I won't get back to that where I'm doing that losing and gaining and losing and gaining.
They call that yo-yo dieting.
It is, and I had a lot of yo-yo dieting for years. So I'm optimistic that this will continue.
Well, continued success.
Thank you.
We thank you for coming on today here on the program. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPH.D. I'm your host, John DeMasi. We'll have Dr. Molly return with more of today's Health Watch after these words. We are back here on Health Watch. Operators standing by right now at Innovative Medical Associates. And the number, 856-489-0505. That's 856-489-0505. When you call, you want to make the initial appointment for the initial consultation with Dr. Molly, 856 888-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Check that out. A lot of good stuff on the website as well. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We are doing the show from Innovative Medical Associates, and we have a very special guest.
We do.
I have to introduce her.
That's right.
The lovely Linda.
That's right.
Hello, how are you, John and Dr. Molly?
You're real. You are a real person, right?
That's for sure. And Dr. Molly pulled me off an extremely busy floor. We are so busy today. I'm like, no, but the lovely Linda must talk. So
everybody wants to hear, and they want to meet the lovely Linda.
Yeah. We've had a lot of interesting people today. We have a weight loss program. Everyone's losing weight. It's fantastic. Women are so excited. Even men on it.
We just had Barbara on, and she was telling us about how she's lost it and how she's lost it slowly,
right?
Which is how you're supposed to lose weight.
And she also gets the IVs in addition to it. And she just told me her back is feeling so much better with the anti-inflammatories we're giving her. So that was good. Yeah.
How long have you been here?
In October, it will be 28 years.
28 years.
Yes.
You've been here as long as... Who came first, Dr. Molly or you?
We came together.
Okay.
We came together, and we stayed together through thick and thin.
Which is really a testament to Linda, I will say that. So, listen... we were always talking about my, people who help me here, and it's a team effort. You heard from Dr. Pat last week, and now I wanted you to hear from lovely Linda. And by the way, it's more of a family type of atmosphere because I treated Linda's mother, I guess, for 18 years or so. God bless her. And like my mother, she's passed on. But I got to tell you, she was a trooper, and she, of course, came to us with a cancer diagnosis and had the cancer diagnosis prior to coming, right, Linda Lou? So I will tell you that Linda has been instrumental in helping this and run the floor. She's one of my best techs here, along with my wonderful nurses, and I will tell you that we couldn't do it without her. So I just wanted her to talk a little bit of her mother's story and some of the stories she sees here, because she becomes my eyes and ears out there. As you know, I always say it's my nurses and my techs who observe, and then they can bring some things to me even when the patient's too shy to say something.
Yes, with my mother, she was given a sentence of 3 years to live, and I wasn't having that, so I brought her to Dr. Molly, and I had her another 20 years. Having a having a good clean diet and coming 3 times a week. So she died at 82 years old. I couldn't ask for anything more.
No, you couldn't.
Yeah.
It used to be way back when you were the only tech.
Yes, doing everything.
And I remember the joke, Linda, when you getting the roller skates on?
Oh my goodness! And now, even though we have a lot more help, it's still very busy. Thank God.
Yes.
People are hearing the radio show and telling people about it, and we're helping a lot of people, and it makes you feel really good inside.
It does. It does really make me feel good too. To do the show. But what have you experienced? I mean, 28 years. You've probably seen it all.
Yeah.
Is there anything that sticks out in your mind? One particular patient or 2 particular patients?
Mike, you remember? It's in Dr. Molly's book, God's Ingredients.
Yes, Michael.
He went all over the United States, and he came to us with banker boxes, and he had no hope.
And I remember, do you remember that Dr. Molly hid him in the other room?
Yes.
So that the patients wouldn't see him.
Yeah, he was scary.
And he looked like something out of a horror movie.
Yeah, in a wheelchair, feeding tube, gaunt. And he was an older teenager, I think 16, 17, yeah. And he's now a lawyer and a doctor. We really helped save his life, and he's doing wonderful now. So that's one of the main, besides so many other stories that helping people.
Yes, and really that was a great story.
Yeah.
And I remember that you guys slept in the facility because he was detoxing from all the drugs that they gave him, one thing to another, and it was unbelievable.
And the next morning we acted like we had just walked in, and we had a whole full day again. So
that's right.
Yep. That was adrenaline.
Yes. Have you found that it works for most people?
Yes, even some with not so serious problems, whatever we all have, but as cancer, autoimmune issues is a big problem. Pain, inflammation, and it doesn't even matter what the name of it is. If you're in pain, you have inflammation, you want help.
Yes.
And so Dr. Molly has in her arsenal of repertoires there all kinds of different things that go in the bag that help the back pain, the hands, the neuropathy, a host of different problems. So I've seen a lot of people, even as they're getting the drip, feeling better, or a few days later, feel better. So
yes,
it does work.
And you've
might take time.
You've helped me tremendously over the years.
That's good.
And I continue to come. I'm a lifer.
Yes,
okay?
you are. Yes, you are. And all of us like to get IVs too, and we're lifers too. So
Yes.
it helps us with our problems.
So you can go back now. You
We're finished.
You did your part, okay?
Okay, all
you
right,
did your
thank
part.
you.
The lovely Linda
Bye-bye.
is here, and it's Health Watch every Sunday, 8 till 9 here in Talk Radio 1210 WPHT. I'm your host, John DeMasi, and Dr. Molly, and who knows who we're going to get next. We're coming back with more of today's Health Watch right after these words.
This program is paid for by Innovative Medical Associates.
We are back here on Health Watch, and again, operators are standing by as they always are when we are on the air here. 856-489-0505. You just heard Dr. Molly talk about some initial consultations, and what those people did and what you should probably do is make the call right now. Make the appointment to sit down with Dr. Molly and go over your situation and your issues. And it is complimentary, so it doesn't cost you anything, and you will learn a lot. 856-489-0505 is the number. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com. That's the website. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. A little bit different today as we are previously recorded, and we're going to talk to some patients. And we have a good-looking gentleman sitting next to you, Dr. Molly, who does multi-things here.
Yeah, and why does he do multi-things here? Well, because he came to me and he had a problem. COVID. 19. Well, I'm so sure. Wait a minute. It's COVID-19, 20, 21, 22. Anyway, Tim is a very good friend of the clinic, and as a result of being here and getting through his problems, and in particular the post-COVID situation as well, he really helps out around here. He volunteers. The nice thing about my patients is they're always very giving. They're very smart people. They want to help other people who have a problem and didn't know where to go. So I'm going to turn the mic over to Tim and you so that you can ask him the questions that you're so good at.
Okay. All right. Tim, welcome to the show.
How you doing, John?
Why don't you, that's it, get that microphone up. That's it. There you go. So what is your story?
My story is I was working one day and I came down with a sore throat, and it turned out to be COVID.
Boy, how about that?
Yeah.
You get a sore throat. Oh, it's COVID. I mean, boy, there was a shock, huh?
And it was 2 years into the pandemic, so I didn't think I even had it. It wasn't, in 2019. It was in 2021.
And you had COVID, and there you go.
Right.
So now what?
Well, I had COVID bad because I was compromised because of my job. I worked around chemicals. So I was in ICU for 18 days.
Ooh.
So they didn't think I was going to make it. But through the grace of God, everything worked out. But I was coming here with the sore throat, and I was getting treated. So I think that had a lot to do with my recovery.
So you felt as though you recovered quicker because you came here?
Oh, definitely. I definitely got through the hospital stay because I didn't have it. I didn't have the fever. I didn't have the loss of strength. I just had lung issues.
And so
they treated me.
They treated with what?
The standard drugs at the time and oxygen. And then after, they didn't think I was going to make it, but I did. And after that, I recovered. I was on oxygen for 6 months. And then I was coming to Molly that whole time, and I think that helped a lot.
Yeah. So did you not retire as a result of this?
Yes, I had to retire. I couldn't go back to my job.
Because you're working around chemicals?
Well, not just that. I mean, I was on oxygen. I couldn't work with oxygen. I was a heavy equipment operator.
Yeah. Oh, so that is not an easy job, right? I mean, that's one of the tougher jobs.
Yeah, I could see me pulling up to the job with an oxygen tube on. They would have said, "What are you doing?"
No, not too smart to do that.
Yeah.
But So how do you feel like every day now? In other words, do you feel any side effects from it or what?
I get out of wind. I'm supposed to go for a yearly CAT scan because my last CAT scan showed that I still had damage in my lungs, and we're waiting. My year is up in August, so I'll go for another CAT scan to see if my lungs healed better, and then to go from there.
But so far, the CAT scans have been
positive.
Positive, okay.
Yeah, progressively positive. They get better and better.
Do you still have treatment here from Dr. Molly?
Yes, just the maintenance treatment.
Okay. Yeah, you're like me.
Right.
You're a forever.
Yeah, definitely.
So the whole thing, I guess we can say, if you didn't come here, you may have been in pretty serious trouble.
Oh, definitely. Yeah. I would have been pretty... Yeah, I think coming here, my wife made me come here. As soon as I had the sore throat, she said, let's go.
Should always listen.
Molly was the one that sent me to the hospital.
Oh really?
Yes.
Oh, yeah.
Because my pulse ox dropped. So Molly was the one that sent me to Jefferson.
Jeez. Always listen to your wife, by the way.
I do. Believe me, Molly saved my life.
So now you're on maintenance, and you come once, twice a week. I mean,
once a week.
Once a week.
Yes.
You're always here, by the way.
Yes.
Because you're also the unofficial chauffeur.
Yeah, right. Yeah.
For several patients.
Any of the customers that can't drive, I help them out.
Yeah. So you're an important part of the facility, but looking for towards the future, is there any other medication that you're on, or?
No, I don't take any post-COVID medication other than what Molly gives me, the nutraceuticals.
And obviously you don't need anything.
No. I do get out of breath, but, cardio has a lot to do with that. I should exercise more to build up my lungs, but, it is what it is.
You should join me in physical therapy. Come on.
More like mental therapy.
Right.
That's what I need.
Yeah. Well, it's a great story, and we thank you for coming on here and telling us your story.
Awesome. I'm glad to tell it. And
share it and give people hope that, there is always another bus out there, as they say.
Definitely.
And we've heard stories, and yours is one of them. So thank you for coming in, and we appreciate it. It is Health Watch every Sunday, 8 till 9, Talk Radio 1210 WPHT. Don't forget, operators standing by right now at Innovative Medical Associates. And if you would like to contact them, 856-489-0505, 856-489-0505. When you call, you want to set up that initial consultation with Dr. Molly. It is complimentary, doesn't cost you anything, and you'll really learn a lot. 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We are pleased to have with us as part of the show today. We're bringing in everybody here.
We are. That's right.
This is Dr. Pat KASICA, who is the medical director of Innovative Medical Associates. And Dr. Pat came here like everybody else. Right, Dr. Molly? She was.
Listen, Dr. Pat had a heck of a journey before she got to me. And she got to me from a referral from a mutual friend of both of ours who is a neurosurgeon. And for that, I'm forever thankful for Dr. Joan bringing her here, because she's the best medical director we've had.
Yes, and I will attest to that.
Very nice of you to say. Thank you.
And the interesting thing, Dr. Pat, that you looked, I can say this, you looked like hell.
Yes.
For a while.
Yes.
And I saw, and I said to Dr. Mullen, is she all right? MS.
Yes, I have MS.
And all of a sudden, it was a couple of months, and you came in. I said, "Is that Dr. Pat?" I didn't recognize you.
Yeah.
So tell us the story.
Yes.
How many years were you with this problem?
Probably I was diagnosed maybe about 15 years ago. I was having a lot of heaviness in my legs, difficulty walking, numbness and tingling from the knees down, fatigue like you would not believe. I was falling asleep behind the wheel. I was so exhausted.
Oh, man.
Yes. And coming here and getting nutritional infusions as well as IV stem cells really turned it around for me. Whereas now, looking at me, you would never even know that I have MS. I mean, I know I have it because I do fatigue, but nowhere near as bad as I was.
No, you wouldn't know you had it now.
Yeah.
No, I mean, looking at you wouldn't know.
I feel so much better.
And I
really
understand that you were ready to give up medicine, and you were looking at other career options.
Yes.
I mean, did I hear the story of you were going to get into the cleaning business? I mean, this is really a bizarre story. Tell us about that.
Well, I was an anesthesiologist and a pain management doctor for almost 30 years, and that is a very physically demanding job because you're wearing lead for a lot of the orthopedic cases. It's heavy lifting of patients after the surgery. They're asleep, they're dead weight. Pushing stretchers with patients that are 200, 300 pounds. It really was very physically demanding, and it got to the point where in today's world everything has to be done quicker and faster and more cases. It just got to the point I couldn't keep up, so I was thinking about what else I could possibly do because I wasn't really ready to retire. So I was looking at other avenues, but now I'm dealing with signing people up for medical marijuana. So I see the benefit of that, especially in pain patients. So
you've come a long way from where you were.
Absolutely.
And it was from a referral from another physician?
Yes. She had told me, I had heard about Dr. Molly, and they kept telling me, you should call Dr. Molly, you should call Dr. Molly. Finally, I did, and I came in on a Saturday to meet with her, and I found that we were kindred spirits. We just got along and had valued the same things, and looking for a different path other than standard medical care, and seeing just what could help me.
And, a lot of the people, and Dr. Molly was just talking before you came on about somebody who came in today and was not diagnosed, and it was like this bizarre story, and they're all bizarre. I mean, when you hear about it.
Yes.
But what do you look for when you're diagnosing a patient? Because obviously you're different, Dr. Molly's different. What are you looking for?
Just finding out what their symptoms are, and then trying to connect the dots to see what could possibly be causing the symptoms. Because if we could get to the source, then we can help the problem. So,
a lot of times, and Dr. Molly has said this many times on the show, that the traditional physicians, I mean, they miss all these things. And do you know why that is? Because I don't understand it.
They focus on one system at a time rather than looking at the whole body. And because they don't look at the whole, they can miss things. And at one time, you went to a family doctor and they looked at everything that was going on with you. Now you go to a specialist and you have a specialist for your pinky nail and your toenail and your foot and your ankle. And, they look at a little piece, but they're not looking at the whole picture.
And really, that's the key, is looking at the whole picture.
You have to look at the whole picture.
And you've been here now. How long have you been in sort of recovery?
Oh, my goodness. It's been maybe, 6 years, Dr. Molly? About 6 years. And I'm doing great.
You have new life.
Yes.
You thought you were going to have to give up medicine.
Yes, I thought, yes. And here it's giving me a whole new
Let me tell you, if she had to give up medicine, I think we'd be losing somebody who really, really cares. And that, my friends, I believe makes the difference here. Yeah, everybody's smart. Agreed. I think she's one of the smartest people I know. But the heart is what counts here.
And certainly. So now you're on what you call maintenance?
Yes.
And you will be on that, like me, forever.
Forever, yeah. Because it helps.
So
yeah.
what? You know,
That's right.
it's a lot of fun coming here. We have discussions, and it's very lively, and it's fun, you know, in addition to getting help. But in the future, what could you tell people if they're having problems and they can't get the help they need or they want? What can you tell them? How could they go about getting the right kind of medical care?
I would say to come on in. There's no, Dr. Molly will see you at no cost, and just to discuss your issues and see what else is available, because it's worth a try. You're not losing anything by coming in and talking about your problem and seeing if something that we could do can help, and it might make all the difference.
And how many times has that happened?
Oh, my goodness.
And how about when we refer people out, which we do?
Yes.
Don't worry. We're not all things to all people, and we're not, crazy. If we need some, but we are, I think, as a team, the whole team here, we really have a breadth of knowledge, and we know other people who are doing a more holistic viewpoint, even in conventional medicine. And we'll get you to those people if that's where you need to go.
Exactly.
Dr. Pat, thank you. Dr. Pat is the medical director here at Innovative Medical Associates. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. More to talk about here as we have patients and we have the medical director. And it's a rare opportunity. And we thought we'd do this for the Labor Day holiday since we wouldn't be live. But we thought we'd do it because we don't get a chance to do it that much. So this is a perfect time to do that. Health Watch is the show every Sunday, 8 till 9 here, Talk Radio 1210 WPHT. I'm your host, John DeMasi. Dr. Molly and guests will return after these words. We are back here on Health Watch, and as always, operators are standing by at Innovative Medical Associates, and the number is 856-489-0505, 856-489-0505. When you call, you know the drill. You make that appointment for the initial consultation with Dr. Molly. It is complimentary, and you will really learn a lot about what she does and how potentially she can help you with your situation. 856-489-0505, and the website, innovativemedicalassociates.com. InnovativeMedicalAssociates.com is the website. It is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We are back with another one of the patients, Dr. Molly. His name is Don, he's a CPA. And
you know what? I want to give a little intro to Don, because he's a very smart guy. Again, my patients are really smart, and he does a lot of research, and he has done a lot of conventional in terms of his challenge. Now, I'll let him tell you his challenge, because, I break enough situations with HIPAA. But this is a situation where I think he's got an interesting case, because he did everything right. And this is what I want to let people know. And there are always options. Do not give up, folks. Keep looking. So here's Don, and let him take it over.
Okay.
I was diagnosed with prostate cancer, and went through the conventional radiation and follow-up with shots, which reduce your testosterone. And it left me tired and, with a lot of side effects, like sore back, sore knees, and came to Dr. Molly, and I felt better and better every day with the treatment she's been giving me. I'm not sure exactly what's in the treatment.
It's working, so you don't really have a concern about what's in it, right?
I don't really care. I've never felt better, and the staff here is great too. When you come in, they're always ready to help you, ready to cater to you, and every time I walk out, I feel better, and I still get blood testing done, and it's absolutely spectacular. When I started out, the doctors use these tests, I guess they're called PSA tests, and when I started out, it was 10. And the last time I checked, they did the check, it was 0.03. So I think,
wow, that's good.
Yeah,
that's really good.
I truly believe a lot of it has to do with Dr. Molly and the and the treatment that I went through. It's always a pleasure to come here.
You reminded me. I get treatments twice a week.
Yeah, I heard about that.
And we're sitting back there. And somebody says to the lovely Linda, "Oh, well, what's in my bag?" And I said, it's really irrelevant what's in your bag. Is it working? Yeah. She said, "Yeah, but been feeling better." I said, "So what?"
I mean, even if I knew it would make any difference, right, because I put my faith in Dr. Molly, and feel that she absolutely knows what she's doing, and. I'm just, I couldn't be more than happy.
Yeah. You were telling me about this situation. How long were you in this problem, prostate cancer, before you came to Dr. Molly?
It's interesting. Again, they use this PSA measure, and I'll be 78 tomorrow. And
well, great.
Yeah.
Happy birthday, by the way.
Yeah, thank you.
We didn't bring a cake, but that's another story.
Right, I laid off the sweets. Dr. Molly said to stop eating, and it's not a problem. But I had an elevated PSA score since my 40s, and over the years it creeped up gradually, and then finally when it reached 10, I went in and I got all the conventional treatments, the X-rays and MRIs and all the other stuff they do. And I think a lot of it's due to what Dr. Molly's given me.
Yes, and back to we were talking about what's in the bag. I mean, there is a protocol for everything.
Sure.
There's a protocol for just about everything, and it's the synergy of what the nutraceuticals do.
Well, but I could tell, Dr. Molly always tells me how smart I am, but I'm nowhere near as smart as she is.
No, just in this deal. Okay, the idea is, though, when you go through a tax season like you guys do, the stress level alone is enough to cause all kinds of metabolic issues, really. And then you have to add with that your clients. I mean, just dealing with them. Because the minute somebody has to write a check, right? Hello, right? God bless you. There's a lot that goes on, Don, and I thank God you walked into our place. He's a great guy. And call the office. I'll give you his number. Okay.
Okay.
What do you mean I have to pay? How many times have you heard that?
Yeah. Well, you always have to give them a refund. No refund. I did a bad job.
God bless you. Thank you, Don. Okay. Thank you so much, Don.
Right. Don, thank you, and we appreciate it, and good luck in the future. Continued success. We have a couple of minutes left. Do you want to kind of wrap up the show?
Well, listen, this is just a cross-section of my staff and also our patients. So God bless. Thank folks for listening.
And really, it was good that we had a chance to hear stories.
Right.
Because you tell the story.
But hearing it makes a difference.
Hearing it from the person themselves
makes the difference.
It really does make a difference. Right. So that is going to put the wraps on another edition of Health Watch. Don't forget, operators standing by right now at Innovative Medical Associates. And the number 856-489-0505, 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Lana, Donna, Jess, Jim, and Daniel. And then, of course, there's Joanne, delightful Dee, fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Have yourself a great week, and we will talk to you next week. Health Watch here on Talk Radio 1210 WPH.D. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey. Today's program has been pre-recorded.